Hello everybody, my name is Alain Schoepfer.
And Jeanine Wakim from the Gastroenterology and Hepatology Department of Lausanne University Hospital in Switzerland.
It's now our pleasure and privilege to present the results and also background information of our study esophageal stricture dilation using Bougie-Cap's second edition in adult patients with eosinophilic esophagitis. Jeanine, can you please tell what was the motivation to conduct this study?
In fact, in 2021, our group has published a study about 50 EOE patients in whom we used the Bougie-Cap first edition to dilate all the esophageal strictures. We've noticed that Bougie-Cap was efficacious, but in fact, due to the suboptimal adhesive properties of this first edition, one Bougie-Cap got detached in the oropharyngeal region of a patient. Plus, green endoscopy is becoming an increasingly important topic in our daily clinical endoscopic practice.
Meanwhile, Ovesco, who produces the Bougie-Cap, has released a second edition, which I can show you here, that comes with several modifications when compared to the first edition. The first being that the attachment piece, which gets in contact with the tip of the endoscope, is softer, which allows a better fit with the endoscope. Second, you have a more round-shaped tip of the Bougie-Cap. The third change is that you have now like a gradual increase of your Bougie-Cap that allows you to dilate, taking 2 1 millimeter steps. What stays still the same is the hole here at the tip of the Bougie-Cap that allows you to advance, if needed, a guide wire. You still have the lateral holes that allow you to insufflate air or CO2 and also to rinse with water. So Jeanine, can you please tell what were the outcomes that were used in this study, what were the main results, and why are they clinically relevant?
So in our prospective observational multi-center study from Switzerland, we included 60 EOE patients who all had symptomatic strictures. The symptoms were assessed using the validated ESI-PRO symptom score, and the stricture was defined as an esophageal diameter of 16 millimeter or less. The patients were evaluated for the symptoms before and 2 weeks after the dilation session. In our study, we've noticed that Bougie-Cap version 2, when used in dilation of esophageal strictures, it led to a statistically significant improvement in symptom score, and it also led to a significantly increase of the median esophageal diameter from 12 to 16 millimeters. Knowing that most of the strictures in our study were located in the distal esophagus, and that we've used a median of 2 Bougie-Caps per dilation session. In our study, we've noticed no esophageal perforation and no device-related complications. We've noticed post-procedural pain in 31.7% of the patients. So, Alain, what are the next steps?
Next steps, Jeanine, is that we are going to evaluate the clinical improvement and also the kinetics of the esophageal diameter, not only 2 weeks after the dilation, but also at 6 months, 12 months, and 18 months. This is ongoing work. And Jeanine, can you please say what can you conclude out of this study?
In fact, we can conclude that dilation of esophageal strictures in EOE patients using Bougie-Cap second edition is feasible, clinically effective, and it is also environmentally friendly. In fact, dilation using Bougie-Cap leads to less waste and less health costs compared to other dilation methods.
Thank you for your attention.
Thank you.
And have a good day.